Hi everyone. This is Majdi Hamarshi, Chairman of Board of Directors of PAMA, and this is one of our series meeting with our medical mission members who went to Gaza, healthcare workers. They've been to Gaza and they are back now to the United States. And I have with me today three exceptional healthcare workers, heroes, who put their life at risk. They left family and work and they went to Gaza. Some of them went twice and most of them are planning to go back. So with me today, I have Dr. Walid and Rana, and Dr. Firouz also is going to be joining us shortly. But I will let them introduce themselves, who they are, their name, where they work in the US, and what do they do, like what was their role in Gaza, and we'll go from there. Walid, do you want to start?
Sure. Thank you, Majdi. My name is Walid Said Ahmed. I am a board-certified anesthesiologist. I am fellowship trained in interventional pain, neuro ICU, and cardiac anesthesia. I was born actually in Kuwait, and finished my high school in Kuwait, then went to Egypt, got my medical degree over there, after which I went to the United States. I got my PhD in health informatics, and then I went for my residency, followed by my fellowships. I've been practicing in Florida since 2004, and have been involved in some humanitarian missions overseas, including the earthquake in Haiti in 2010, and that's pretty much it.
Sure. And Walid and Rana and Firouz, they joined March 25th medical mission to Gaza, and they stayed for 2 weeks and they exited Gaza April 8th. And next will be Firouz. You want to introduce yourself to our audience?
Yeah, my name is Firouz Sidwa. I'm a trauma surgeon and surgical critical care intensivist in California. I did my residency at Boston Medical Center and then my fellowship at Cooper University Healthcare in Southern Jersey. And I did a Master of Public Health at Harvard as well. I've been working in Palestine actually since just after college. I actually lived in Israel in Haifa and worked with an Arab Jewish cooperative there for about a year after I graduated from college. And then after my first year of medical school, I went back and worked at Achli Hospital and Aliyah Hospital in Hebron in Khalil. And then after that, I tried to go to the Gaza Strip actually to do an all-cause mortality analysis. That was for my Master of Public Health. It was going to be my thesis project, but I wasn't able to gain admittance to Gaza for various reasons. So but other than that, I've worked in Ukraine, I've worked in Zimbabwe, I've also worked in Haiti like Walid, and so yeah, been around.
Very good. Well, nice having you with us. Rana, you're next.
My name is Rana Mahmoud. I'm a registered nurse. I've been doing trauma and emergency room. I've been a nurse for 20 years, and I've been doing trauma and emergency room for the last 7 years. I've also focused on wound care. This is my second medical mission trip with PAMA during this genocide, and it's my third medical mission trip in 1 year to Gaza. And I'm here with PAMA again.
Very good. Well, like a quick introduction about PAMA for the audience who don't know PAMA. It's Palestinian American Medical Association. We've been in Gaza and Palestine helping Palestinians since 2013. So we've been doing medical missions to Gaza before the recent war, and we basically target different areas in the healthcare sector in Palestine, including promoting education, training, capacity building for hospitals, and also we have special interest in children with congenital anomalies, PTSD, autism, and psychosocial rehab of children with Gaza. So this is who PAMA is, and we've been in Gaza before, and we're going to be in Gaza as long as Gaza and Palestine needs us. So I want to ask each one of you, how did you hear about this medical mission, PAMA? How did you get connected to us? How did you sign up? How did you know about us? Rana, you might want to start back with you.
I believe I got an email. Initially, when I heard about PAMA, it was actually through an email, and I signed up with PAMA back, I believe, in December or November. And then my first medical mission trip in January was with Dr. Yusuf Khilfa, which I believe he's one of the co-founder in PAMA. And that's how I heard about PAMA. It was actually my first time hearing about PAMA. And I have to say, I'm very honored to be traveling and part of PAMA.
Well, thank you. Walid, how about you? How did you hear about these missions?
Well, it was a story that was similar to Rana's, except that it goes back to 2008 when I wanted to go so bad to Gaza after I heard about the atrocities that was going on back in the date. And I wanted to go, and I joined Doctors Without Borders. And I wanted to go at that time, but for some logistic reasons, I could not. Then until recently, I learned from my wife, who actually approached me and told me that there was a friend of hers who told me about this organization called PAMA, Palestinian American Medical Association, that could facilitate the process. And I was so encouraged, and I sent that email with, some valid, good dreams about going over there and doing what I needed to do. Luckily, I was fortunate to receive confirmation that I was selected amongst those. So I was so happy that I was selected. And in fact, it was a last minute kind of thing that was so rewarding to me. And, I wish I could do it again and again.
Thank you. Thank you, Walid. How about you, Feroz? How did you hear about us?
Yeah, I actually got I'm a critical care intensivist, in addition to being a trauma surgeon. So I'm a member of the Society of Critical Care Medicine, and they sent out a notification of PAMA's call to volunteers with the WHO. So
yeah. Well, I want to give shout out to SCCM. They responded to our call for volunteers, and I want to say we have about 1,000 SCCM members who signed up for PAMA missions. And as you know, SCCM is international society, and we have people from different countries, mainly the US, diverse group of people, and also diverse in their profession. As yourself, you are a trauma critical care. We have nurses, we have RT, we have anesthesia, ER critical care. So I have a very diverse group of volunteers who are waiting to go to Gaza. Unfortunately, we are limited with how often we can go and how big our convoy can be. So, but I hope one day all of them will go to Gaza. Well, awesome. So I want to ask questions, but please feel free to make your comment, branch off, and it's just going to be freestyle discussion, trying to cover what is going in Gaza. And my goal, I hope I can achieve that, is try to paint a picture for people about Gaza and what's going on, and that picture will be painted by you. You are healthcare workers who went to Gaza, serve patients in Gaza, and you might have the chance to observe the general atmosphere in Gaza, around the hospital, on the way to the hospital, across the borders, and all that. I want to start with how easy was it? How easy was it to go from Cairo to arrive to the hospital? That journey, and what was anything? How was your first impression getting in Gaza? What was the first thing that caught your attention? Feroz, you're on the camera. What was that?
Yeah, we landed. Cairo Airport is a big place, obviously, but we stayed at the hotel that's right there, which was perfect. We hauled all of our stuff with some help. Actually, Rana was instrumental in getting me through Egyptian security. And unfortunately, I have Israeli passports and Israeli passport stamps and Ukrainian passport stamps. So I think I probably set off some alarm bells for that. But the guy traveling by myself. But no, once we were out of the airport, the next morning, we all got actually I think Rana, we got there at like 3:30, I think, actually, to the actual hotel. And then 3:30 a.m. And then so we basically right away started organizing our bags, getting them loaded up into the vans that PAMA had secured for us. And then these vans went over to I forget the name of the part of Cairo that it was, but it was where the UN's Office for the Coordination of Humanitarian Affairs, OCHA, is. And there was a large convoy of, as far as I can tell, entirely humanitarian workers, and going to Gaza through Rafah from there. I remember Oxfam, MSF, IMC, every the alphabet soup keeps going. Every humanitarian organization that I am well acquainted with was represented there, which was really great to see. I think some people from UNICEF, I think some people from UNRWA. Yeah. So then we got in the vans. Obviously, the Sinai is there's a bit of a challenge to the Egyptian central government going on in the Sinai. So there's a lot of military checkpoints, and it takes a while to get through the Sinai Peninsula. But it took a while, but it wasn't terribly difficult. And then when we got to Rafah, the first thing, it doesn't have to do with how hard it was to get there, but the first thing we noticed was just the miles and miles of trucks that are backed up, aid trucks, and not just aid trucks, but commercial, regular commerce that's not allowed to go in, just trucks and trucks and trucks of stuff that was meant to go in. And it seemed like, actually, I'd never heard of the World Central Kitchen, but at that time, but it seemed like a third of the trucks were for the World Central Kitchen, just waiting to get in. And they were backed up for miles. I mean, almost to El Arish. It was wild how much of a backup there was. And then once we got to the Rafah terminal, we got our bags. It's more like a small city airport than it is like an international terminal. It's definitely not set up for industrial scale processing of commercial shipping goods, things like that. Which obviously is a big problem, but because it's Gaza's only real lifeline to the outside world at the moment. And so it's very, very, very slow going through there. It's each bag individually through one conveyor belt. I've heard from some other PAMA members that went before us that if the scanner is broken, then they open each bag individually. So thank God we did not have that happen, because that would be an all day and all night affair. But even still, by the time we got through Egyptian control and then through Palestinian control on the other side, it was dark outside for sure. Do you guys remember? It must have been like 9 or 10 o'clock at night at that point.
Yeah, we didn't get to the hospital till like almost 9:30 at night.
Is that what it was? Yeah. So we must have left Rafah at 9 or 9:10. And then we obviously Majdi, but for the audience, there's what's called a deconfliction mechanism, which obviously doesn't work very well because there's been plenty of attempts despite it. But there's a deconfliction mechanism where the team leader gets on an app of all things and waits for your route to turn green. And I think you can request this once every 3 hours, and then once it turns green, you have 15 minutes. So the van drivers absolutely just floor it because they don't want to be on this route for anything, not even 1 second over the green time, because that just kind of opens you up for all sorts. Even though these are marked vans, they say Palestinian Ministry of Health.
Feroz, do you want to explain to the audience that the conflicting order, who is on the receiving end of it?
I'm like we say, I'm no expert, but the Israeli military has an office called COGAT. I think it stands for Coordination of something, I don't know, but it's you probably know, but it's COGAT, and basically the app is an attempt for COGAT to communicate with all different humanitarian organizations that are moving around in the Gaza Strip. So UNRWA uses the same thing, PAMA and WHO use the same thing, Oxfam, everybody uses the same app, but it's I don't know the structure of the Israeli unit the military unit that it goes to, but it's with the Israeli military itself. And the Israeli military, as far as I understand, I'm sure there's a written arrangement that actually explains it in more detail. But as far as I understand, the Israelis agree not to attack anything on that road, and to accept that anything on that road for the next 15 minutes is humanitarian traffic and not to be attacked directly. And when we went in, we were all maybe blissfully unaware. I've been involved with the conflict for a long time, so I guess I knew, but I guess I tried not to think about it. But on the way out, that was after the World Central Kitchen bombing had happened, and we were all very, very frightened actually by the leaving trip, because these, it was quite obvious that these people had been targeted on purpose. And there is, the deconfliction mechanism is great if the Israelis adhere to it, but if they don't, then they also know exactly where you are, and if they want to find you and do something, they can. So it's a double-edged sword in that way. But the idea behind it is to safeguard humanitarian traffic. It just doesn't always work out though.
Very good. Thank you, Feroz, for that explanation. So how about you, Rana? What was the first time getting in Gaza, or arriving at the hospital or walking in the hospital hallways? What was the first thing when you went the first time to Gaza? What was the first thing that caught your attention and you still remember it vividly, if you can recall it?
It's honestly first time and second time. It hasn't changed. The hospital is not a hospital. The hospital is a refugee camp. Unfortunately, this is a hospital that holds 200, patient beds, which right now is occupied by 12 or 13,000 refugees. And you have people using sheets to make a home for themselves, and that's how they build their privacy, by a bed sheet. Believe it or not, you have a 2x2 or a 4x4, little space that 10 people lives there, and all they have is maybe a mattress and a bed sheet for their privacy. Then you have people living on the stairs. Then you have people living in a hallway. Then you have people living by an elevator, and then you're sharing bathroom with 400 or 500, maybe even 1,000 people. And if you were previously there as a patient, you stay there. You basically don't get discharged because there's no place to go. So a hospital is not a hospital. I call that a refugee camp.
No, you're not the first one to call it that way. Many of my guests from previous missions, that's what they called it. It's a refugee camp. That's what it is, full of tents, full of sheets, and people who are not who are displaced, and they are living there. That's what the refugee camp is. No, I agree.
Yeah.
It's even
yes.
a camp. It's even a refugee camp for the people who work in the hospital. Most of them have their family living there, which I didn't expect that. There's people living in the operating room, sterile processing facility. There's people sleeping in the scrub next to the scrub sink. There and not random people. It's people who work there. But it's the amount it's hard to miss the displacement. That's for sure.
Well, again, I was also told ICU, by some ICU doctors.
Yeah.
They live in the back of the ICU is converted into a little little kitchen, and because they have no food delivery, or they cook, they do everything there at the back end of the ICU. Interesting.
That's Walid, that's where they did everything. Yeah.
Walid, what was the first thing that caught your attention going into Gaza? I know, I remember first time I went into Gaza as an adult. I used to go there as a child. I grew up in Palestine, but first time I went on a medical mission, I was waiting for that. What I want to go and see. But Walid, can you describe what was the first thing you caught your attention?
Well, the first thing that caught my attention was basically the amount of people that were there. It was just, I can't describe how crowded and how packed it was from the time we got into Gaza until we got to the hospital. The hospital, as Feroz and Rana described, didn't look like a hospital to begin with. You have a very large population that is occupying a very small piece of land. So you can figure how things are in such fashion. You have, I don't want to say thousands of kids, but, scores of kids just running around in the hallways of the hospital. You have a lot of people just hanging out. You can feel how people are lost in that vicinity, and within the hallways of the hospital, you don't have a structure basically in the hospital of how people are distributed. You just have people. So you're just surrounded by people, sick people, people who are not sick but just live there, as Rana and Feroz just described. It was just a sad looking scene. Um, the fact of the matter is that we were just overwhelmed by the amount of casualties, overwhelmed about the amount of misery we saw over there. It was just so saddening. Yeah.
And the Gaza population, for those who don't know it, half are children, and the other half divided between men and women, like adults, men and women. So every time you go in, you find like 10 people, 5 would be children, 2 or 3 women, and the other 2 are men. Is that the kind of population around the hospital? Is that what you saw?
I was able to see mostly children,
Wow.
and obviously women, because they just have to be closer to their kids than males are. But you could only see those children running around, approaching you, saying hi, stuff like this. But it was mainly women and children in that area. Obviously, as you keep digging for more people, you're going to see more, more people of different ages. But the vast majority of people were just women and children.
I want to ask a question. Sometimes I hear the mainstream media ask that question, and I think it's important to ask. Like, you guys being there, have you seen any militants in the hospital or around the hospital? It's like
Never.
Not at all.
Never.
No. Yeah.
Not
Well,
at all.
this is important because you guys been there, and you know how easy it is to accuse. So I've never imagined that a Shifa hospital would be raided. I said this is a disaster if it happens. This is the biggest hospital in the whole Gaza Strip. If you lose a Shifa, you lost half of the health system in Gaza. And guess what? We have no Shifa hospital now. Nothing. It doesn't exist anymore. And when I was one time, like in an interview, I was saying, I've been there. I've not seen any militants there. But and most people who are there, they say the same thing. Now I want to ask you the question.
100% of people who go there say the same thing. Not most.
Yeah, 100%.
Like Mats Gilbert is a famous Norwegian anesthesiologist. I think he's from Norway. He said he's worked in Shifa Hospital for years. He said, he's just said straightforwardly, I wouldn't work there if it was a Hamas base. Why would I go do that?
Right.
It's ridiculous. And the same thing with European hospital. I can count on one hand the number of like military age men that I even treated for any injury, despite seeing, what Rana, 8 or 9 mass casualty events while we were there at least.
Yeah, exactly. About 8 or 9.
Yeah, and the funny thing is, of the military age men that I treated, they were the least injured people. So it's clearly that they weren't the target. So I doubt they were. Just because they were military age, I seriously doubt they were even combatants. And none of them came in with a unit, with a commander, nothing like that. They all just came in with my family. They're shrapnel.
And unfortunately, all my nightmares turned out to be happening on the ground. Like now, my next nightmare. We're living in a nightmare. So is that European hospital will be accused that we need to raid it, we need to go in it, because then they're going to start making accusations. You've been there, you're describing it, 13,000 people there, lots of children. How catastrophic that will be if anyone thinks to raid the European hospital?
Well,
you go ahead. Yeah. Yes, Walid.
well, I mean, looking at the whole situation and how it was inside the hospital was again, it wasn't a hospital. It was just a place where scores of people, thousands of people live, and just try to live with basic, less than basic requirements for life. At any moment, if this place was, jeopardized by any entity, it would have been a checkmate kind of thing. It's over. Those people would just die. Those people would just vanish. There is absolutely no way there's no protection of any kind. There is absolutely no minimum kind of requirements to protect these people from even the least kind of harm. So imagine some kind of military raid to the hospital. By any means, it would have been catastrophic on the spot. It would be so easy for people to just, I mean, I hate to switch that subject, but it was just so noticed that the bombing takes place during certain periods of time when there is some sort of a guarantee that people will be gathering in one area, like, for example, during iftar time or during sahur time or fajr prayer. This is when we would hear most of the bombing and explosive going on. And those times are when families are kind of gathered in a very tiny little space, trying to have a bite. So there is some sort of you can guarantee that any kind of explosive will cause some significant damage, even if it was with a small magnitude.
Yeah, so I want to move on to, you've been there, you've been taking care of patients. I want to start with you, Feroz. Like, can you describe the patients you've seen? Can you describe the trauma cases coming in? What kind of traumas, the diversity, the population you've been treating? And go ahead.
No, yeah, absolutely. Unfortunately, there's not much diversity. Well, I should say unfortunately, but there's not much diversity in the trauma that's coming in. It's children with mangled extremities and women with mangled extremities. Everyone else dies in the explosions of their homes. One of the I don't speak Arabic, unfortunately, but I got to know a young woman who was volunteering there. She's an American paramedic. But she speaks Arabic fluently. So she and I were speaking to a lot of the Red Crescent drivers or ambulance folks, and they explained that they know which buildings in Han Yunis are occupied and which ones are not, because families, like Walid implied, families are very much concentrated, and not just mom, dad, and 4 kids, but like huge, like clan level families are concentrated in one building, hoping that that'll provide some protection. So they know when a building that is occupied is destroyed, and that when they do, they alert us that there's then they keep track of it. They actually keep pretty good records. And they say, there's 40 people in this building, there's 60 people in this building, so they know how many people should be pulled out, but they're not. They get, it's still a mass casualty event for that hospital because it has no capacity to speak of. But the 4, 5, 10 people will come in, and we'll ask how many. We think there's 40 people under the rubble, but there's no way to get them out. There's no heavy moving equipment, nothing. And I'm a trauma surgeon, so my main job is to stop, in the United States, my main job is to stop people from bleeding to death. But you can only do that if they get to the hospital relatively quickly. I thought I was going to be doing lots and lots of hemorrhage control operations. The thing you see on TV, get in there quick and stop the bleeding before they die, kind of thing. But I think I did one. Honestly, I think I did one. Yeah, I did one. It was the inferior vena cava and gunshot wound injury that we were also proud of. Walid really saved the day on that one, actually. But other than that, because anybody who needed a hemorrhage control operation, they died before they could get it. If their house crashed onto their chest or their abdomen, they died in their house. Probably a miserable and awful death. Actually, the very first person I treated there, she was a maybe 25, 26-year-old woman in Easter. I can't remember exactly how old she was, but she had, I think, 4 children. And Rana, I can't remember if you translated this for me or somebody else did. I think it was somebody else, but she came in with one of her legs was broken at the femur and the tibia. The other was broken at the ankle. It was her left leg was broken worse. She had a huge chunk missing out of her thigh. And we took her to the operating room, stabilized the bones, dealt with the soft tissues, but we had to operate on her at least half a dozen times while we were there to get this wound in better shape. And eventually her mood improved. She was more talkative. She started to call me and mark her American surgeons, which I thought was really sweet. And but she told us she was in her living room when the house exploded, and she saw all of her children thrown into the wall and killed in front of her. And they're still in the house. How are they going to get them out? There's no a 1-ton concrete block in Gaza right now. So that's the kind of injuries that we dealt with. Obviously the injury itself is very bad, but the psychological devastation, even if these injuries heal, which is not a guaranteed conclusion. Yeah, I think you'd have to send half the orthopedic and plastic surgeons in the world to Gaza and build 10 new hospitals just to get through all the wound care that needs to be done. And I'm not exaggerating about that, but the psychological scars that some of these people have endured will last forever. We had another little girl. If I'm going on too long, just tell me, by the way. But we had another little girl, a 9-year-old girl named Juri. We found her. Actually, it was a very strange. It shows you how overwhelmed the hospital is that this kind of thing can happen. I was doing debridements after iftar, and she just shows up in the pre-op area. And they were like, "Can you do this debridement?" And I said, "I've never seen this young girl in my life. Who is she?" They're, "Oh, well, it says she needs debridement on the piece of paper." So I look at her and I just noticed that there's maggots in her bed. So I said, "Yeah, I can do debridement." So we take her, we roll her on her side. Both of her buttocks are completely destroyed. Her, I think it was her left leg, is missing about 3 or 4 centimeters of femur. There's a huge wound. A huge, not wound, but soft tissue defect, just exposed open bone. Sciatic nerve is gone. It just, total disaster. And again, I think I operated on this girl 3 or 4 times. And then the team from Ideal started operating on her because we didn't have a plastic surgeon with us. Dr. Rose, Victoria Rose, did a great job. Mark and the orthopedic surgeon from their team shortened her femur. So this girl, I mean, she shouldn't die if she continues getting good wound care, but she has one leg that's shorter than the other. Her knees aren't at the same height anymore. So it's going to be impossible for her to walk with anything other than the most horrendous limp until she's much older and can get a femur lengthening procedure. She also needs a free flap, probably a latissimus free flap from her back, taking the biggest muscle out of her back and sticking it into her leg. That's an incredibly advanced operation. We can't do that at the hospital I work at in the United States, let alone in Gaza European Hospital, when like Rana said, it's a displaced persons camp and there's women cutting up chicken in the ICU sink. It's just, it's good. The injuries are bad, but in a healthcare system that wasn't being subjected to the fastest killing of children that's happened in 50 or 60 years, it would be doable. But in the system that exists and that is completely overwhelmed, and especially like you said, with the elimination of 30% of Gaza's healthcare capacity by destroying Shifa Hospital and all of the most advanced healthcare capacity that was at Shifa, which is a huge medical complex. And it's been raised. I mean, it's barely a series of buildings anymore, let alone a hospital. These are going to be very difficult things to get over. And that was my impression.
No, thank you, Feroz. I want to make 3 comments on what you said. For our audience, iftar time, it is when Muslims break their fast in Ramadan, and this is at the sunset. And what Walid was also saying before, that much of the bombing happens at that time when people who are fasting sit down, family time, break the fast. And also one more thing, Feroz, you mentioned you guys worked on a case that has IVC trauma. You mentioned bleeding. which is the inferior vena cava, which is the big vein in the abdomen, was injured. I want to tell you, Feroz, and I want to, and we're very proud of you, PAMA, that the WHO is looking into this case as an exemplary case taken care of with multidisciplinary team, and they are reviewing it. Yusuf As-Sabi, you know, he told me about that, and they are looking at that, and we'll see if the team need to be involved or not. We'll let you know. But we very proud of you. The last thing I want to talk about, which is I want to come back to, which is the consequences of war. Please remind me to come back to that if I forget. But I want to move to Rana. Rana, what you've seen cases. You've initiated a program with PAMA wound care program, and now we have a wound care clinic. We have a designated place in the European hospital, and you trained a wound care team that is up and running now, even if you are not there. So this is beautiful. But can you describe the cases you've seen, the ages, the genders, the children, what kind of cases, and how?
I would assure you that
if you remember any personal human stories of it. Yeah, go ahead.
Of course, I will assure you that 90% of our cases were children and females. And just like Feroz said, it's almost impossible for these people to recover from these injuries. These are severe injuries, but we are trying our best with the wound care team. The severities of these injuries are unbelievable, and they're very, very hard to recover from. And you know, like I said, 90% is children and females, but you know, with our wound care team right now, we are operating from a clinic. We have daily hours from 9 a.m. to 2 p.m. and then we're also rounding on them like in hospital. Wound care, I would tell you about 80% of the hospital suffers from severe injuries, which is why wound care is our main focus. Also, the operating room is 80% of the operating room time is also wound care, and they're wound care, they're wound debridements. And then Feroz and most of the physicians there were doing wound care debridement, and they were operating on all those injuries. So 80% of the OR were directed to wound care, which is why we created the wound care team. All I could tell you, I do want to share this as a parent. If 90% is female and children that are severely injured, and if one child goes missing in the US for 10 minutes, we get an Amber Alert to our phones, right? Because that child life matters. But if 90% of our, you know, the people that are being injured are children, I just want to know, does Gaza children life matters to the world? You know what I mean? And the patient that Feroz mentioned, of course, the pictures are very, you know, they're very graphical pictures. But if we were to share one of those pictures, I guarantee you no one could tolerate the pictures. If we would share any photos at this point, no one would be able to tolerate those photos if we were to share them. This is a 9-year-old female that suffers from severe injuries that would be unable to cope with any of those injuries that she has right now.
Rana, just because of exactly what you just said, I had I'm the program director for my residents, so I run their little teaching conference every week, and I just saw a guy who spent I think about a year in Iraq as a military surgeon. I showed him the pictures of Jure, and he actually started crying this morning when he saw.
Yeah, I believe it, because I look at her photos every day.
Yeah.
I call out every single day. I make phone calls for her to be transferred out of Gaza to seek further medical attention. And I make daily phone calls and daily messages for her to get, you know, to seek further medical attention. And all I have to say is that Gaza children lives don't matter to anyone in the world at this point. That's all I have to say.
It's a very, very unfortunate, the dehumanization of Palestinian lives that we see left and right. I mean, I say to everyone, Gaza situation and the war on Palestine and on Gaza is very revealing. It revealed a lot of things. It revealed the the beautiful, strong, faithful nature of the people of Gaza, their persistence, perseverance, and their love for life, and the level of dignity that they have. And I've heard amazing stories about their heroism, but also, unfortunately, it was revealing how the world is dehumanizing their lives and not treating them as equal. Walid, what can you describe among the cases you've seen? Anything you can remember you want to share with our audience?
So one of the most heartbreaking things, I mean, we've been soaked in heartbreaking situations the whole time, but one of the most heartbreaking things that I have seen probably in my entire life is when I was coming out of the area where we sleep in, and there was a little car, yes, a car coming inside the hospital. Looks like a family was coming out of that car, and with that family, two members of the family were two little boys. I'm not sure if they were boys or girls, I have to say, sadly, because I couldn't identify how their faces. But the face was, the two kids were probably in 6 or 7 years old, 7 or 8 years old, something like that. I could not identify a structural, an anatomical structure in their face. I could just not identify it. And when I saw that, I'm known amongst my colleagues to be a tough guy. When I saw that, I just couldn't hold my emotions when I saw that scene. It was something that I have never seen, and I never imagined the brutality that led to such a sad outcome with those little kids. This is something that I don't believe I will forget in my entire life. Now, with that being said, that does not negate the fact that on a daily basis, on an hourly basis, as you keep walking around, you're being pulled from your clothes by people, by random people with injuries. And they just ask you, they beg you, we want to go to the OR to get this wound cleaned or this thing done. And I'm not a surgeon. My job is mainly in the operating room, but I was making boxes of supplies, and I would go to tents just in an attempt to make a wound change. I will get my meds and stuff like that and do it in tents under very inhumane circumstances. You see those wounds. The wounds are covered with flies. The smell is offensive, very awful, because those patients, unfortunately, sadly, didn't have a wound change for almost a month or so. So it was a very, very sad situation. But I would never forget the image and how these two little kids look like in my life.
Yeah. Thank you, Walid. I want to also, Walid, you've been on the team. I want to give like some positive story that your team, and you've been on the case. You performed the first open heart surgery in Gaza since October. And that was a nice thing to share with the world, that despite that collapsing healthcare situation and Burley Operation Hospital and concerns about hygiene, that you pulled that case together and saved a life there, and you saved many lives. I just want to congratulate you for being part of that team. Rana, also you shared a story. We shared it on social media. Kids in the state of Kansas, children, they prepared toys, handmade toys, and they wanted to share them with the children of Gaza. And Rana was nice enough to carry it with her, and she distributed them to the children, and she took pictures. And that was very, very touching. When I shared it with my community here in Kansas, it shows the true humanity inside all of us, that we are one thing. But it's unfortunate, despite all that Palestinians are being dehumanized, and we need to do more and more. And I want to say PAMA made a call for ceasefire, and we tried to forward letters to congressmen and women and trying to explain to them why ceasefire is very, very important, and unconditional ceasefire and permanent ceasefire, because we are now, like with what the medical missions we are doing and all charities are doing, this is a little band-aid on a big expanding wound. It is good, but way not enough. And without ceasefire, we cannot do enough. We need ceasefire to send more medical missions, to move freely, to move between hospitals, to live outside the hospital if we can. Now we cannot rent a house outside the hospital because of the deconflicting orders going to be limiting us, but we are looking into that. So ceasefire is very important so we can save more lives. We can stop the influx of injuries to these hospitals that they are already overwhelmed. So I want to each of you speak on the importance of ceasefire and why, if you agree with it, that's what we need to call for, and why it's very, very important. Walid, you are on the camera, so you might want to start.
Well, as you just said, Majdi, I mean, this is something that is a must-do thing. I mean, there is no other solution. There's no other side talk that needs to be. It's just stop this aggression immediately without delay. And we've been talking for months now about this, and people, you know, the whole world has been talking about this. People are protesting. Some people are just against, but there is a consensual agreement that this thing has to stop. This aggression has to just disappear, because without stopping or a ceasefire decision, this whole thing will continue to bleed, and more life will be lost. It's just something that it cannot continue. There have to be efforts that have to be done immediately for the immediate time, and that is to continue the healthcare and humanitarian support to Gaza without interruption. This will aid providing some minor relief to the people of Gaza. On the long run, there has to be a continuation of some, just relentless effort to prevent this human catastrophe from happening again. But until that point happens, again, we have to work hard on all fronts to encourage ceasefire. And it has to be a permanent ceasefire. There's no temporary humanitarian ceasefire. It has to be a permanent ceasefire. There's no temporary thing that has to be done. We should be on a peaceful offense, and I'm saying peaceful offense on all the time by continuation of the efforts to show the ongoing, or to slow down the ongoing suffering, and just relieve people from this misery.
Sure. Rana, what do you think? Why is it important to tell the world that ceasefire is a must? What do you think, Rana?
Well, we talked about healthcare, but we also forgot about educational system. Gaza right now suffers from all kinds of perspectives. There's limited electricity, there is limited water, there is no education for the children whatsoever. Not even for I met with people that they're just waiting to sit for their boards, or some MD students or some nurses, or even just anyone that was seeking education. They spent so much money in their entire life going to college or school, and now there's nothing for them, right? And then these children that are basically in the streets, they have nothing to play with but sewage or sand, and they're not getting any education. So there's no healthcare, there's no educational system, and now we're prolonging all the people that are been wounded and injured. Now we're prolonging their recovery because there's no healthcare system. You're talking about the European hospital. The European hospital is the only standing hospital right now in Gaza Strip that is serving 2.4 million people. And it's the only hospital that basically has functional operating rooms. So yes, ceasefire is a must. And by the way, I just got the news that Jur is going to be evacuated from Gaza in the next 24 hours.
Oh,
And I'm
good.
very happy for her.
You know where she's going?
She's going to go to Egypt for first stop. And then inshallah, I'll arrange for her for further medical attention. And then I don't know where she's going to end up, if
That's
here in the
fantastic.
US or
Do
Italy.
you have Rose's number?
Yeah, I do not have Rose's number, but I would
I'll
love to.
text her and let her know then, just because she was actually hoping to get her out to Qatar because she works
Well,
there.
yeah,
so-
this
but
yeah,
yeah.
this yeah,
Sorry.
these are
Okay.
good news.
Okay.
These are good news, Rana. Yeah, we
Yes, it is.
are
It is. So,
recording.
yes,
We are
please-
recording. Yeah, yeah. So,
ceasefire
but
is a must. It's not an
Yeah.
option at this point. We must have ceasefire because we need to function on what's left right now. And like I said, the European hospital, we speak about healthcare because we're medical healthcare providers, but we forgot about everything else. Like, these people have no basic life needs. They're displaced. There's no electricity, no water. There's no bathrooms. There's a lot of people like they don't even have bathroom use. Like, can you imagine not having a bathroom? You know,
Right,
these people
right.
live in tents. So
Yeah.
ceasefire is a must. We must have ceasefire.
How about you, Feroz? How important that is for our audience to understand why we're calling for it?
Yeah, I mean, without getting into why this is how the war is shaken out, the fact of the matter is this war has caused an enormous destruction of civilian human lives, which I don't think anybody nobody argues otherwise. Literally not a single person, not the most ardent anything. And just as a factual matter, the burden of injury is far beyond the capacity of anything that is available, even in the entire region, quite honestly, but especially in Gaza itself, to deal with. And so as humanitarians who are, our whole raison d'etre as humanitarians is to save lives. And that is just quite simply impossible, just for all the reasons we were talking about. Like you said, it's putting a Band-Aid on a giant wound. And there is no scenario where the healthcare system in Gaza in the next 10 years can even catch up to what is what's sitting in front of it just today, let alone if there's an invasion of Rafah, if the entire population is moved out to the beach. It's completely impossible. And beyond that, it's not, and of course the vast majority of the suffering is on the side of the Palestinians, but even in southern Israel, people haven't gone back to their homes. People in northern Israel are still displaced from their homes. The Israeli hostages that everybody claims to care so much about are not being freed by this relentless Israeli onslaught on the Gaza Strip. And again, I don't mean to equate the suffering of different people. I don't like to rank human suffering. But even if your only concern is the hostages, who are of course also a humanitarian population and do need help, the only time any significant number of hostages has been released is during a prisoner exchange and a ceasefire. It's just perfectly obvious that that's the only way this is going to work. So if you care about Palestinian lives, if you care about Israeli lives, if you care about children's lives, if you care about hostages' lives, if you care about anybody's lives, a ceasefire is the only way to go about preserving those lives, to go about rebuilding the lives that have been interrupted and shattered and destroyed by this absolutely horrifying conflict that I think all of us have seen up close. And without a cessation of violence, there is no way that either one of these societies will pull back from the brink that they're on right now. And certainly no way that the individual people who need help will get it to any substantial degree. So that's what
I can't say it better than that, Feroz. And as you said, ceasefire is needed to save lives, and that's what I keep saying to everyone. Those who link the ceasefire with releasing the hostages, as if they are saying we're gonna keep killing children till you release the hostage. I said no, let's stop killing. Let's save lives. And people are not aware that some of the hostages might also unfortunately die because of the bombing and ongoing fighting. And let's ceasefire, save lives on both sides, and take care of the humanitarian issue, including Palestinian suffering and the Israeli hostages and displaced Israeli populations on the borders and all that.
And also in Israeli prisons. It's a long list. It's a long list.
It's a long list. So we call for ceasefire and let politicians take care of the rest. So that's what we're trying to say. But the other thing I want to say, which Rana shed the light on, which is the consequences of war. We need to be aware if there is ceasefire now, unfortunately lives would be lost to the ongoing issues of the damage that already happened. People will die of the wounds, infections, and the lack of health system, and also people need to know that there is no life in Gaza. Like I give you just one sector of the Gaza population: medical students. I'm not talking about anybody else. Just taking that one. There are about 3,200 medical students in Gaza. If there is ceasefire today, they have no campus to go to tomorrow. No campus. And PAMA is joining efforts with other charities to try to provide a solution for them. We can do some virtual learning for the like basic medical science years, but I'm not sure what we're going to do about the clinical students in clinical years. So every sector in Gaza population has been affected for years to come. And people need to understand, if there's ceasefire now and the whole world started pushing aid into Gaza and humanitarian aid and skills and expertise, we will need 5 to 10 years to rebuild Gaza back. So, I mean, we need ceasefire now. I want to have each of you, try to end with shedding the light on the heroism of your colleagues in Gaza. If you can remember a scenario, a human story of a physician or a nurse or any healthcare worker you interacted with during these 2 weeks, and you would like to shed the light on them, on their suffering, on their heroism, on their whatever you choose. Whoever want to start, I don't want to put you on the spot.
Are you referring to locals or you're referring
to
our
local?
Sorry guys, I have to run to the ICU. Do you mind if I just
go for it? Go through it. Yeah.
You know, there was an anesthesiologist, there is an anesthesiologist named Ayman at Gaza European Hospital. He's a Palestinian fellow. And actually his family lived in the room right next to the room that Walid and I and 4 others slept in. And so we would walk back and forth from the hospital together frequently, and he spoke English very well. So I got to know him a little bit. And I noticed that when he went into his room, there were 4, I was expecting other doctors to be in there sleeping with him, but there were 4 young women. So I said, "Oh, is that your family?" And so then we started talking. His wife was killed in the bombing of their home. His only son was killed in the bombing of their home. And then he has 4 daughters left. They're like aged like 6 to 20, I think. And so I ended up talking to him more about it. And you know, he was the most enthusiastic anesthesiologist other than Walid that we had at no real, I mean it quite seriously. He was very much like, let's get it done. Let's do it. Let's do it. Let's do it. And finally one day I just had to ask him, I said, you know, your wife is dead. Your son is dead. How do you manage? How are you so enthusiastic? And he stopped for a second and he said, you know, honestly, I come to work so that I can prove to my daughters that life can go on, but I feel almost nothing inside. And when I wake up at night terrified, I reach out and grab them and they say, "What are you doing? What are you doing?" And he's terrified that he's going to lose them as well. And that it's an absolutely unbearable burden for anybody. And I don't know how he manages it. He can't manage it forever though. And he's one of literally 2.1 million Palestinians that have the exact same fear. They've all lost somebody who is very close to them, if not an immediate family member. Most of them have lost a child, or at least a child in their near family, if not their immediate family. Like Walid said, there's or like you said, actually, there's 40% of Gaza is under 15. I think 90% of Gaza is under 30. So it's a very, very young population. Everyone knows a child who's been killed, at least one. And that burden that they are attempting to work through is, I think it exposes their deep decency and their refusal to be inhumane, even in the face of dehumanization, and the dignity and the steadfastness that these people display is, to me, it was extremely humbling, and it was a good lesson to see what.
Thank you. Yeah.
Yeah.
Thank you, Feroz. No, I appreciate that. This is amazing story. And I mean, again, this is, as you said, this is the story of most people that you did not talk to. Like, you had the chance to talk to him. He speaks English, so you have the time to know his story. But we all know that this is the story of everyone in Gaza, and they are true heroes. They are true heroes. And I hope.
But they shouldn't have to be. And it's our responsibility to, like you said, to call for a ceasefire so that they don't have to be heroes. They can just be human beings and live their lives.
Yes. No.
Sorry.
Thank you. No. Thank you, Feroz. Thank you. I appreciate you. Thank you. Okay. Bye.
Thank you, Feroz.
So, yep. Rana, Walid, who's gonna go next to shed the light on a colleague in Gaza, one of the locals, the ones you met?
I would love to shed the light on Dr. Ahmed Mkhallalati. He was
Ahmed Mkhallalati, the
yes.
the neurosurgeon, right? Yep.
No,
plastic surgeon.
Ahmed Mkhallalati is a plastic surgeon who started out in Shifa, and his house was bombed. His house was bombed. His father, his wife, and children were there. Luckily, they stayed alive because they were in the wrong, lucky they were on the other side of the house. But his house was bombed. He and many other healthcare providers were in the Shifa hospital, and they were blocked in there, and they were held hostages. They weren't allowed to leave. And they were there for months and months. And so was Hakima Wafa as well with them, who's Nurse Wafa. They were at the Shifa hospital, and they were there for months. And then finally, when they were giving the way to leave, he came to the European hospital, and he built a plastic team. He just built a team from medical students. And Dr. Haytham Sultan is another hero who is like a primary care physician, and now he's a plastic surgeon.
Wow.
Under
Amazing.
Training from Dr. Ahmed Mkhallalati. Ahmed Mkhallalati trained many medical students who were soon to graduate, and so as a primary care physician, he trained them to be plastic surgeons right now, and they do wound care debridement in the OR, under a physician supervision. But he trained a huge team because that's where the primary of the care is. But Dr. Ahmed Mkhallalati, he told us his whole story, and how he would be like questioned every day, and how they didn't have food for days. They didn't have food in the Shifa hospital, and how they didn't have water for like days as well. And how they actually, he even shared with us how they, when they bombed a house that was nearby, how one of the employees in the Shifa hospital ran to that house, and they thought they were stealing because they were taking that food from a house that's already been bombed, because they had no food and no water for days. I mean, it definitely is a story that, of course, that follows with a lot of details, but he is my hero. And so is Dr. Haytham Sultan. Honestly, they're my true heroes in Gaza. They really are.
Thank you, Rana, for shedding the light on their lives. And again, we know they are all heroes. And as Feroz said, they did not need to be. They just want to be living their own lives like anybody else. Walid, any story you want to share with us? Shedding the light on healthcare workers in Gaza, the local ones.
Yes. Well, you're basically surrounded by heroes all over the place. I mean, you can't describe them for less than heroes. I dealt or had the opportunity to discuss thoroughly and in detail the story of Dr. Yahya. I believe his last name is Matar, and he was an ENT doc. He came to our room. He was having tea with us, and he started telling us this story of how he was, for the last 15 years, he was trying to get a license to build his house up north in Gaza. And finally, he got a license 2 years ago and was able to move into his house a month before October of last year. 2 months later, his house was hit, was turned to rubbles, and he just had to be displaced, obviously, to the south, where he joined the main force in the European hospital. He said that he has spent all his entire life collecting for this house that just vanished in a split of a second. Yet he was able to carry on responsibilities. He wasn't getting paid, obviously. He was just working on a voluntarily basis, just treating patients in the hospital relentlessly and just doing his job like a hero. I also met Dr. Majid Gabin, who was covering anesthesia and ICU, was going back and forth. He was displaced from up north. He moved with his family to the hospital. He lives in the hospital. He's been living in the hospital for the last, I think, 5 months or 4 months in a tent. And then wakes up. He's the first one to come to the operating room. He is the chief of anesthesia in the hospital. He covers the ICU as well. And he just works and works and works. The only thing he carries in his hand is the Quran. He was just walking around with the Quran. Whenever he gets a break, which rarely happens, he would sit down and starts reading. Whenever I would see him, I would just go run to him and give him a kiss on his forehead. I mean, this is what the least I could do to this hero. When you see those kind of models, you just realize those are just super normal human beings that just adore a lot of suffer, but yet they don't complain. They just don't come and fuss or just, whine about their misery, but they live the misery day and night, yet they are heroes.
Because this is who we are, healthcare workers, and we don't abandon our patients. That's what we do. That's what we are wired to do. And it happened to them. They were under harsh war situation and they stepped up to it, and they showed the heroism that is in every healthcare workers. But the Gaza healthcare workers showed it, and we want to remind the world that the world has lost more than 400 healthcare workers during this war. 30 hospitals out of 36 hospitals were destroyed. Many ambulances and journalists and aid workers and so on. This is to add to the 35,000 or more, half women, half and children that have been killed so far in the war. Well, I appreciate you being with me. I know we can keep going for hours, and we will not even give an accurate picture of what's going on, but we're trying our best to paint a picture to the world of what you guys have seen in Gaza. We appreciate in PAMA your heroism.
Majdi, I know you want to wrap this up.
Yes,
I understand you want to wrap this up, but I just have to mention this before we go.
Please.
For anything to change in this whole thing, in this whole disaster, there has to be some change in the rhetoric that the media has been using over and over again. There has been a straight out bias of the media, of the Western media. And I just hate to say that, but it is what it is. There is an imbalanced reporting of events. There is a language bias by the media. There is a context omission where everybody is just talking about what happened in October without any mentioning to the historic events that led to that day. There is a selection coverage where most of the events are being focused on like one side suffering over the other. Obviously, the suffer of the aggressor rather than the suffer of the victim. There is a normalization of occupation. There is a lack of accountability of those sources. there is erasure of Palestinian identity altogether. There is just focus on Palestinian quote unquote violence and downplaying ongoing Israeli state violence and aggression. And last but not least, there is a limited Palestinian representation that needs to be put into action, into consideration actually, and has to be reinforced by improving that for better outcome. I just had to mention that about the Western bias.
No, I appreciate your input, Walid. And again, we understand where you're coming from. And again, this is unfortunate, and we wish, and this is another call I want to make through your comments. We call for opening Gaza to international journalism. We want the world to go and see what's going on, so the Western media can firsthand report what you are describing and what's going on in Gaza. Otherwise, it is unfair, and it is double standard, and this is a long-lasting conflict that has been described by international human rights organizations as apartheid. The ICJ is looking into it as possible genocide, and so on. This is a call from you and me, Walid and Majdi, to open the borders for journalism and Western media journalists to go in and see themselves what's going on. Thank you. No, thank you, Walid. Rana, anything lasting word you want to say?
Honestly, I'm just going to emphasize on ceasefire and the importance of ceasefire, and to look at these children's lives, that they matter. And I just want to call out, I'm not even going to call out to the medical or healthcare providers. I'm going to call out to all the parents out there, because I know there's a lot of them. If your child was injured at a soccer field or just outside in a playground and you had to go to urgent care, you were fortunate enough to go to urgent care and get them stitches, just imagine these children with explosive injuries that they have to live with for the rest of their lives. So I'm only calling out on all the parents, asking all of them to please help us out to demand ceasefire.
Thank you, Rana. Thank you, Rana. Thank you, Walid. And we'll wrap it up here again. We appreciate your volunteerism. We appreciate your time in Gaza, your service, and God bless you. Okay?
Thank you.
Thank you. Thank you for having us.
Bye-bye.
Thank you.
Bye-bye.
Thank you.